This conference will now be recorded.
ఏందన్నా ఇది లాజిక్గా రియల్ క్యాలిక్యులస్ యూరిటరీ క్యాలిక్యులి. Hello.
Yes, sir.
Today we'll discuss about the ureteric calculi. Last class we discussed about the renal calculi, you know. The ureteric calculi next. So today we'll discuss about the ureteric calculi. Okay. What is ureteric calculi? The calculi which are present in the ureter is known as ureteric calculi. So this is the common kidney stone, renal calculi and ureteric calculi. Both the things you should know. Okay, most of the ureteric calculi are arising from the kidney itself. So whenever the kidney stones are there, they can migrate from the kidney to ureter. So that is the ureteric calculi. So what is the etiology? The same as the renal calculi, like hypervitaminosis D, vitamin A deficiency, and certain hot climates. Okay. Next, auxiliaries. So whatever the etiology related to the renal calculi, the same thing may be applied here also. But there is no ureteric stone formation in the ureter itself. So all the stones which are developed only in the kidney, from there they are migrating to ureter and reaches to the bladder and spill out. So that is the same etiology for the development of the ureteric calculi. So the shape of that ureteric calculi, the ureter is just looks like a tube, so that they are elongated. Width is less and length is more. Next, sometimes these ureteric stones are migrating from the kidney to ureter. They are impacted, get some narrowest parts in the pathway. So what are those narrowing parts? You should know. One is at the pelvic-ureteric junction. You see, so here the pelvis is broader and ureter starting the point of the ureter is narrow. So this is the point where some obstruction can occur or impaction can occur in the ureteric stone. Next, crosses the iliac vessels. Where the ureter crosses the iliac vessel, there is also a narrowing part. There is a place to impact the ureteric calculi. The next one is where it crosses the vas deferens or broad ligament in the female. It also get impacted here. So where it crosses the vas deferens or broad ligament. Next, when it enters into the bladder, or that portion may be, there is another chance of ureteric obstruction, the narrowing part. Here also the narrow can occur. Next, once it enters into the bladder itself, the intramural part. Intramural part means near to the trigone, where it opens, there is also narrowing part of the ureter. So there is a place where it is impacted. So normally the ureteric stones are minimum 5 to 8 millimeters are in size. They may be passed away from the kidney to ureter and the bladder, and through the urethra it will come out, flush out from the urethra. But if it is more than 8 millimeters, it may obstruct in any pathway of this narrowing parts. Pelvic ureteric junction, where it crosses the iliac vessel, where it crosses the vas deferens, or where it enters into the bladder in the outer part, and once it enters into the bladder, that is called intramural portion of the trigone or bladder. So these are the common places where there is chance of impaction of the ureteric calculi. Once it is impacted, some consequences may be developed. What are the consequences? obstruction, hydronephrosis, infection, like this. So what are the problems which develop due to the obstruction of the ureteric calculi? Here you discussed the obstruction. So once the ureter stone is obstructed in the narrowing part, there may be a chance of development with hydronephrosis. Once the hydronephrosis is developed, it is not treated properly, it may go into the infection, so it may produce the some pyonephrosis or perinephric abscess or pyonephric abscess, like this. Some impaction. Sometimes there is no complications like obstruction or hydronephrosis, but impacted. So once it is impacted in the particular region, there may be chance of development the hydronephrosis once again. Next, ureteric strictures. What are the ureteric strictures? Some oxalate stones are there. Oxalate stones are surface is spines, spickless. It is not a smooth. So when it passes from the kidney to ureter, what happened? The mucosa is eroded. So once the mucosa is eroded and heals together and may produce the ureteric strictures. That is also one of the complications of the ureteric stones. So these are the problems: obstruction, hydronephrosis, infection, sometimes impaction can occur, and ureteric strictures. So what are the clinical features a patient may have when developing ureteric calculus? First, patient may develop pain, that is a colicky pain that radiates from the loin to groin. Loin to groin. Groin means from the lumbar region to inguinal region, because the course of ureter is like that. So the kidneys are located in the lumbar region. So from the kidney, lower part of the kidney or middle part of the kidney, the ureter has been developed and goes down towards the groin region. So the pain is radiating from the loin to the groin. What is the reason for that migration of the pain? Due to the genitofemoral nerve. Understand? Once in the males, it may migrate to the genitalia, like tip of the penis and testicles and labia majora in the female. So that is mainly due to the presence of genitofemoral nerve. So this nerve can carry the pain from loin to groin. Sometimes this type of pain may be intensified or increased during the exercise. So sometimes the same, it also mimics the appendicitis. So appendicitis is also situated in the right iliac fossa. The renal colic is also like that. So it may be appendicitis, or it may be a cholecystitis, or it may be any ovarian malignancy, or any tubal pathology like salpingitis. Salpingitis means inflammation of the tubes. All these conditions which produces the pain. So the similar type of pain may be seen the following conditions also, like appendicitis, cholecystitis, any ovarian malignancy, or tubal pathology like tuberculosis of the Salpinx, like this. So next symptom, patient may have nausea and vomitings and sweating. So what is this cause for the development of the nausea and is mainly due to the vomiting, is mainly due to the pyloroplasm reflex. The reflex of the pyloroplasm so produces the vomiting and nausea. Sometimes patient may have hematuria. Hematuria is due to the passage of these oxalate stones erode the minute vessels which are lies in the mucosa of the ureter. So once the mucosa of the ureter is eroded, the minute blood vessels are ruptured and may produce hematuria. Patient may have a dysuria. Sometimes patient may not pass the dysuria urine. Next, frequency. Just like these symptoms may also seen in the BPH, benign prostatic hypertrophy, like frequency, strong urine. These are the symptoms may also present in the ureteric stones. Next, when you palpate that lumbar region, there is a tenderness in the right iliac fossa as well as the renal angles due to the presence of stone in the ureter itself. But no rebound tenderness. Rebound tenderness means when you apply the pressure over that lumbar region and release immediately, patient may feel pain. But such type of character is not present in the ureteric calculi, which is present only in the appendicitis and cholecystitis, but not present in the ureteric colic. So you can diagnose like this. Rebound tenderness is absent in case of ureteric calculi. Next, how you will diagnose this case? So you have to do some investigations. What are the important investigations? We have to examine the urine for microscopic RBC examination. Sometimes micro blood vessels RBC may ruptured, produces the hematuria, or sometimes oxalates can be seen. Then certain infection can also have been found in the urine. That is duty for which you have to do culture and sensitivity of the urine. Next, you have to take the plain X-ray of kidney, ureter and bladder. So KAB X-ray has been taken in PA view or AP view. So 90% of these ureteric stones are radio opaque. So you can easily identify these are the oxalate stones. So uric acid stones are radiolucent, but even though it is there, but it cannot be seen in the X-ray. So what is this stones, where it is located? If it is ureter, it is always lies transverse process of the vertebra. If we take an X-ray, these transverse process of the lumbar vertebra, tip of the transverse process of the lumbar vertebra, these lines, ureteric stones are located, or sacroiliac joint, or medial to the spine. So these are the anatomical identification of the ureteric stones when you take in a plain X-ray of the KUB. Sometimes you can take not only the anteroposterior view, AP view, but you can also take lateral as well as oblique view to differentiate from the other opacities which are mimicked like stones. So mostly you have to do PA view, but sometimes you should also take lateral and AP view of the plain X-ray of the abdomen. Next, intravenous pyelography. So what is the use of this intravenous pyelography? So you can diagnose the hydronephrosis or hydroureter, and also to know the status of the functional status of the kidney. Next, isotope urinogram is also there, one of the investigation. This is helpful to know the accurate function of the kidney. Next, another serum blood examination, blood for urea estimation, serum creatinine estimation, and serum calcium levels, uric acid levels, because there are several types of the stones are there. Oxalate stones are there, uric acid stones are there, cystine stones are there, urate stones are there, xanthin stones are there. So you should estimate the blood levels of the different solutes. Next, ultrasound. Similarly, ultrasound is also useful to know where it is located, that stone, either in the kidney or ureter or bladder. You can diagnose by the ultrasound. CT scan is also helpful to diagnose the ureteric stones. So this is the plain X-ray of the abdomen. You see there is a ureteric stone present in the course of the ureter and just related to the transverse process of the vertebrae. This is the lumbar vertebrae. Here in ultrasound of the ureter, you can see the intramural portion of the stone. This is the intramural portion of the stone. You can diagnose by the ultrasound of the abdomen, a bladder. So how do you treat? So when your patient develops severe pain, you should give some analgesics. First, you have to give fluid therapy. Why you have to give fluid therapy? To flush out the ureteric stones from the kidney to ureter to the bladder and through the urethra it may come out. So diuretics to be given. What type of diuretics usually you have to give? Furosemide or spironolactone is useful to flush out the ureteric stones. Next, you should give some antibiotics. Why you have to give antibiotics? To prevent the development of the sepsis or infection. And patient may have a pain. That pain may be due to spasm of the ureter. That spasm should be relieved by the antispasmodic drugs like dicyclomine hydrochloride. Okay, whenever there is a spasm, severe renal colic is there, urinary colic, you should give some antispasmodic drugs like dicyclomine hydrochloride to be given or cyclopam. Next, if the patient is having a multiple stones in the ureter and kidney on both sides, you should give IV infusion. So that IV infusion, you have to give some normal saline, minimum 1.2 2 liters, and add with the injection like furosemide diuretic. That dose of that diuretic is minimum 60 to 80 milligrams, given intravenous drip, and minimum should be given 3 to 5 days to flush out all the ureteric stones. That is the fluid therapy. Next, if it is not responded to the fluid therapy, you have to do surgical intervention. So what are the causes, indications for the surgical intervention? So when you will do surgery, the first indication is when there is a size of the ureteric stone. It may be more than 8 mm or 1 centimeter. That is one of the indication to surgical intervention is needed. The second indication for surgical intervention, so when you do the intravenous urography or pylography to know the deterioration of the function status of the kidney. So in such condition also surgical intervention has been needed. Next, some coexisting infections like any pyonephrosis are there, hydronephrosis. In such conditions also you should do surgical intervention. Next, another indication is when it is impacted. You know, I already discussed about the various positions like pelvic ureteric junction, or where it crosses the ureter, renal vessels, the iliac vessels, and where the ureter is crosses the vas deferens, and where it enters into the bladder. All these are narrowing points. Sometimes these more than 1 centimeter of the size of the ureteric stone may be impacted, so that it may leads to develop the hydronephrosis or hydroureter. So these are the complications may develop. So these are the conditions where the surgical intervention is needed. So the surgical intervention is needed depending upon the location of the ureteric stone. So you know the ureter are divided into 3 parts: upper part, middle part, and the lower part. I will tell the diagram. I will show you. So this is the upper part, this is the middle part, and lower part. So depending upon the location of the ureteric stone, you should go ahead with the surgical intervention. Suppose if it is present in the upper ureteric border, what you will do? So ESLW, electroshock therapy. So electroshock therapy may be given if the stone is located in the upper ureteric stone. So the stone is pushed. Suppose if it is stone is pushed in the renal pelvis, what you will do? You have to push the stone into the kidney and later it should be removed by the percutaneous nephrolithotomy if it is in upper region of the ureter. Next, URS. What is URS? Ureterorhinoscopic stone, that is an instrument or a device may be used to remove the stones through the ureter. So the ureteroscope is introduced and to visualize the stone and fragmented that stone by applying the pneumatic bomb border. So pneumatic application is there. So you should cut down that stone into the pieces and extract by the ureteroscope. If it is a single one, large one is there, you should do like that by using the ureteroscope. Ureteroscope means you should the instrument which is used through the ureter, that is called ureterostone. Okay, some complications may also develop by using this ureterostone may likely to perforate the ureter. Or once the ureter is perforated, what happened? Extravasation of the urine in the pelvic cavity or peritoneal cavity can develop. Next, if these things are failed, you should do open surgery. That is called open ureterolithotomy. So you have to open the abdominal cavity and identify the location of the ureteric obstruction and remove the stone by open method. Incision of the ureter or open the ureter and let out the taken out that ureteric stone. Okay. Next, when the stone is situated in the middle of the ureter, so you have divided the ureter into three parts: upper part, middle part, and the lower part. So the upper part you have discussed what you have to do. Suppose if the ureteric stone impacted in the middle of the ureter, so what you have to do? So it's the same thing. URS to be done. URS means ureterorhinoscopic device. It should be used to remove the stone from the ureter and open method. Suppose if the stone present in the lower one third of the ureter, what you have to do? Same thing. URS to be done and Darmia basket. So sometimes they may ask you the Darmia basket short notes. You should know a little bit about the Darmia basket. That is a device instrument may be used when the stone is impacted in the ureter and the lower part of the ureter especially. So next, open lithotomy. Suppose if it is present within the bladder, at the opening of the ureter into the bladder, you should do open the myototomy. Myototomy means you have to enhance the opening of the narrowing part and remove the stone. That is called ureterotomy. So this is the Darmia basket. Suppose there is a device passes from the urethra and enters into the upper part of the lower end of the ureter. So this is a stone is impacted here. So this Darmia basket has to introduce inside and apply the pneumatic dilatation to be done and pull down so that the ureteric stone may enter into the bladder. From the bladder, you should use ureteroscope and remove it. So this is like this. That is the mechanism of Darmia basket you can use to remove the lower one third of the stone's impaction of the ureteric stone. So what are the indications when you will apply this Darmia basket procedure? One is when the stone is present in the lower one third, or when the stone is present below the pelvic brim, or when the stone is less than 10 centimeters in size. If it is more than 10 centimeters size is there, you should do open method. So it should be at least minimum 1 centimeter size should be there, or less than 1 centimeter is there, you can use this method. Or small single stone is there, you should also use this Darmia basket. So what are the complications? So what are the complications you may expect? Sometimes dislodged. The stone may be dislodged. Suppose while you are while you are extracting this stone, sometimes it may be dislodged to somewhere and rupture of the ureteric surface and may dislodge in the pelvic cavity. That is also one of the complications. The next, urethral injury. So while you are introducing, you may likely to injure the urethral membrane. So patient may develop hematuria. Sometimes ureteric everulsion of the ureter. So there may be a complete through and through cut can occur. That is called everulsion of the ureter. Ureter can occur by using the force by the Darmia basketing device. Sometimes stricture can occur when while you are passing, the mucosa may be eroded, and later subsequently after some time there is a chance to develop the ureteric strictures. So these are the complications of the Darmia basket. You should write what are the indications, what are the complications, so how you have to remove that stone from the Darmia basket. Yes, I explained. You see the various positions, upper part, middle part and lower part. So if the stone is present in the upper part, you should do fluid therapy, flush therapy or ESLW, PCNL, URS and open ureterolithotomy. Suppose if it is middle, flush therapy, URS and open lithotomy. It's lower one, flush therapy, URS and Darmia basket and uretic myototomy and open ureterolithotomy. Okay. Even if you remove the stones, sometimes there may be a chance of recurrence of the stone formations. A little bit something you have to know about the recurrence of the renal stones. What is meant by recurrence? So there are two types of the recurrences are there. Hello? చూసావా? ఏది? అన్నాడా? చెప్పాడా? ఇది చేసే లోపల చేస్తాడు, చేసేస్తాడు. ఏదో ఏంటంటా నువ్వు మెష్ బిట్టా? అదే అదే వేస్తాడు. అదే సిమెంట్ వేసేమన్నా ప్లేట్స్ లాగా అది వేసేస్తాడు. అది అంతలో అది వేసేస్తా ఉండండి. అది కోటింగ్ పెట్టే లోపల ఇది అవుతుంది కదా. పుట్టి పురమాయించి ఎన్ని బస్తాలు పడుతుంది? రెండు బ్యాగులు తీసుకొని నేను డబ్బులు పంపిస్తాను. ఈ నెంబర్గా ఉందా నీకు? ఇది ఎంత ఇప్పుడు బ్యాగ్? కాదురా, ఫ్రంట్ పెట్టు. అటు కూడా పెడితే పెట్టే, వెనకాల కూడా ఎంత నీట్గా ఉంటుంది. సర్లేదు తీసుకొని నేను పంపిస్తాను. ఎంత అవుతుందో చెప్పి నాకు పంపిస్తాను. ఓకే. అదేరా చేద్దాంలేరా, ముందు పెట్టు. ఏం కావాలని తెచ్చేసుకొని నేను అమౌంట్ పంపిస్తాను. నువ్వు ఒకటి తీసుకుని ఎంత అయిందో నాకు చెప్తే నేను అక్కడికి పంపించేస్తాను. అది నువ్వు నీకు పంపిస్తాను, వాడికి పే చేసేది. కానీ మెటీరియల్ ఏం కావాలో అంతా తీసుకున్నావు. ఓకే. Okay, now we have to discuss about the recurrence of the stone formations in the ureter. So what are the types are there? There are two types are there, false recurrence and the true recurrence. What is meant by false? What is meant by true recurrence? The false recurrence means some intervention has been done, some left over the small fragments in the ureter itself or bladder itself. That is called false recurrence. Even though you have to remove some of the stones are there, some fragments may be left over. That is called false recurrence. What is meant by true recurrence? True recurrence means the recurred stone will once for all stones are clearly by the intervention. So that means whatever the stone is there, you have to remove it. Again after some time, the stone may develop in the ureter. That is called true recurrence. Understand the difference between this and that? False recurrence means some part has been left over. True recurrence means completely removed the previous one, and again the same place may be filled with the ureteric stones. That is called true recurrence. So what are the causes for this recurrence? One is, for example, some some diseases like hyperparathyroidism, hypercalcemia, hyperuricemia, gout, cystinuria. These are the metabolic disorders may associated with the associated with the recurrence formation of the ureteric or renal stones. So how we will prevent these stones, recurrence of the ureteric stones formation? How we will prevent? First, we have to maintain the hydration. So hydration means we have to give fluid therapy. So fluid should be given adequately to flush out the ureteric stones. Next, diet. So what are the things to be advised in the diet? So you should avoid to take the rich in calcium oxalates, sodium and vitamin C. So these are responsible to convert the oxalates. So that you should avoid to take intake of these materials like calcium oxalates, sodium oxalate and hypercalciuria, vitamin C. Next, ask them to intake the dietary fiber. So the diet should contain a lot of amount of fibers. So that should be advised. What is the advantage of dietary fiber? So these dietary fiber blind with the calcium and decrease the calcium absorption. And sodium cellulose phosphate is used to reduce the calcium stones formation. In certain uric acid stones are there, you can give allopurinol drugs to reduce the uric acid level so that uric stones may be reduced. Next, the diet contains the magnesium. So what is the advantage of the magnesium? This magnesium can combine with the calcium oxalates produces the less soluble calcium oxalates. Similarly, you should give aluminum gel, ammonium chloride drugs to be given to prevent the acidity. Acidic urine can also, the one of the etiology acidic urine may produce ureteric stones. So you should give alkalization. Next, other drugs are like penicillamine, alpha mercaptopropyl glycine. So these are the drugs which can use to reduce the cystine stones formation. So the cystine metabolism may be prevented by giving this penicillamine or alpha mercaptopropyl glycine materials that can be reduced the cystine metabolism, so that what happened, the cystine stones are reduced. So these are the various methods to be drugs to be used to prevent the recurrent formation of the stones. Similarly, you should give calciuria is there. In such conditions, you have to give 5 milligrams of bendofluorothiazide. So if you give bendofluorothiazide, you should reduces the loss of calcium in the urine. So it reduces the calciuria. Calciuria means excess of calcium passes through the urine. So it can be prevented by giving fluoride. You should give 5 milligrams. Similarly, you should give indomethacin, same thing, to reduce the calcium secretion. And similarly, you have to give sodium phytate, can be given to reduce the calcium formation. Another drug like acetohydronic acid, acetohydroxyminic acid, it can be reduced to reduce the urea. So what happened? The urea splitting organisms are there. That organisms can be damaged by giving acetohydroxyminic acid to be given to reduce the urea splitting organisms, to inhibit the development of ureteric stones. So this is the chapter I have completed. Completely you have to cover the renal calculus. Okay. So what next class? What should I tell it to you? Hello.
Sir.
So far I have covered the renal system. Bladder. Shall I start the bladder chapter or finish it?
Not finished, sir.
Prostate over. Hello.
No, sir.
Anybody has taken the class about the prostate? Urinary
Sir,
bladder cover is not done,
genitourinary
huh?
system.
Pardon?
Genitourinary system has left, sir. You had completed the urinary system now, sir. You start the genital system.
Genital system, urinary system, bladder have to complete, isn't it? Have to tell about the bladder.
Yes,
No,
sir.
sir.
Start with bladder, sir.
Huh?
Start bladder, sir.
Okay, start bladder. Next class onwards, we will take the class for bladder pathology. Okay? Thank you. Okay, shall I glow?
Yes, sir.
So kidney we should read thoroughly because they can ask so many questions in the chapter, in this chapter.